Hello everyone and welcome to Rad Chat live at UKIO. My name is Naomi Anderson and I'm joined by fellow host
Jane McNamara.
So we've got a lovely guest here who's got an injury. Would you like to introduce yourself please?
Thank you. My name is Naomi. I currently work at UKIO University and I'm a professor of simulation.
So, for anyone who's not watching this podcast, do you want to explain what's going on?
What's wrong with your face?
What's wrong with my face? So, I'm currently sporting a black eye and also a laceration above my head with some bleeding on my face. We've just run a Moulage workshop at UKIO just to show people what can be done with special effects makeup to improve the education of students and learners.
And it was absolutely incredible, kind of just observing you and the participants was incredible to just see. Yes, it's a bit fun, and you get to play with lots of kind of nice simulation equipment, but also just the conversations people were having as a consequence of doing it. What was your insights from kind of running that workshop?
You're spot on, it is a bit of fun, but I think it's really important to get across the safety components of using Moulage. I think some people, I've wormed my way back through to your podcast hiding my laceration so that I don't upset anybody and they get concerned. But so covering the safety components of using Moulage, but also the benefits of using it in the education. I think everybody in there was surprised at actually how easy some of the moulages are to create, and you can use home products as well to do it. And I'm hoping that some of them have gone away with some thoughts on how they can integrate it into their education.
It was nice as well because it was full. Obviously we were a bit worried before that no one would turn up, but everyone turned up, even if we dragged them in. And it was a good mix of diagnostics and also therapeutic side.
Absolutely. I think myself supported obviously by Liverpool University, Barry, and Daniel and Bridget, Paul Knockwood and both of you guys. So we had lots of support, but I don't know how many people we had in there, but we certainly managed to deliver quite a few different moulages in our hour slot. We covered bruising, lacerations, thermal burns, scalded burns, radiation burns of various types. I'm trying to think if we covered anything else, but everyone had an opportunity. Skin cancer, demonstrated some of the prosthetics that we can apply to people as well. Just to bring
Had the open captures on the side.
Yeah.
That was quite cool. I think for therapeutic, we're obviously to see that. It's not something you would see.
No, I suppose not.
Anyway.
Yeah. Unless it's on yourself.
Yeah. Speaking from experience.
I would say it's something that I wanted to do at UKIO for the past few years because I think people are always a little bit intrigued, but maybe just don't realise the impact that Moulage can have in the training. I was sharing with them about the whole cognitive load. So if I asked both of you two to, you've got a patient in front of you who's got laceration, you might well be thinking, I might need a band-aid or a small plaster, and you might be imagining something that's a gaping wound. And you're using all of that memory about imagining, and you're potentially not on the same page. Whereas as soon as we give you this small cut, you know exactly what to do with that patient. You know possibly the mechanisms of injury that's caused it. It opens up so much more in terms of their thinking and their actions.
And obviously you did your doctorate study on simulation and the use of Moulage. Do you want to tell us a little bit about that?
Absolutely. So it was, I looked at, it came from introducing students to a patient that had facial burns way back, and what I was witnessing was student reactions to me wearing a burn on my face, and I thought, gosh, if that's what a patient sees, then that's not good. It was all there in the non-verbals, they were all hiding behind themselves. So that was kind of the initial thought process behind it. So I started my doctorate in looking at how Moulage could emotionally prepare students for seeing open wounds when they go out in clinical practice, because diagnostic radiographers, their first day might be in theatre, they might visit resus, they might have trauma patient on to CT, and they might well not be ready for that. So introduced students to a very simple Moulage prosthetic on an ankle, asked them to x-ray the patient, and then we did a debrief. So it was a very small, simple intervention. Followed the students through on their journeys, and actually what we found was the group that had that opportunity as the simulation felt better prepared for their clinical placements. They'd had the opportunity in the debrief to talk about how they thought they were ready to communicate with the patient, but how jarring it was for them to see a patient who have a wound and be in pain. And what do we say? How do I make this better? How would explore what they would do with that patient? So all of the negative emotions that came with seeing that decreased in our experimental group compared to the control group that hadn't had that opportunity. And yet the really nice thing for me, and I think it's really important to maintain that excitement for clinical placement, is that actually was maintained whatever group they were in.
Right.
So when they came out from clinical placement, a lot of the students started saying, well, I was okay, I felt this around that wound, but I felt better. Like I knew what to say, I knew how to be with that patient. I didn't feel as shocked because I'd had that opportunity. It's sad to say, but some students don't have that opportunity to talk so much with major officers and supervisors on placement. And the thing that I love about simulation is that debrief component. So and that trains students and others that go through debriefs how to talk about their emotions, how to open up, how to critically think about how they're going to do something different. And that's an added skill that when you're using simulation that we are gifting or that we're training students to be able to do when they're in clinical practice. If we don't do that, they hold on to those bad experiences. They may not know what's going to happen next with that patient. There's a lot of unknowns and a lot of fear because they don't have that closure.
Well, let's be honest, it could put them off to such an extent that they decided to not enter the profession. When actually, had they have been supported and almost built resilience slowly to what they were witnessing, actually it helps them cope a bit better and develop those skills. So yeah, it's so important. And I think it's easy to think, oh well, we don't need simulation in higher education. We've got clinical practice, that's what it's for. But it's, as you said, it's that safe space. You can be psychologically safe to kind of disclose your emotions and what you're feeling and be quite honest. I've had students before who've been like, I am going to vomit if I see a fungating tumour. And I'm like, right, well, you can't do that in front of a patient. So, let's talk through the process that you're going to have to do and, what mechanisms are there for using, from us for clinical practice. We all do it, don't we?
Exactly.
It comes in very handy sometimes, but, it's things like that that then help you be able to treat and support your patient with care and dignity and respect.
Absolutely.
The other thing as well is that as a student, seeing a radiographer diagnostic or therapeutic, that difficult patient might be the first one you see of the day, and you've got to get on with the rest of your day like nothing's happened, and be professional, and then you deal with it at your own pace. But in like a simulation like that, talking to some of the people, they're like, actually, I've seen a skin reaction like this on a radiographic patient before, but it's only now I'm realising, what I could have done better and stuff, and it's just nice.
Yeah.
It's a nice controlled environment.
Absolutely.
So, and that, it's good.
I think one point that we have to make as well is you need to consider what Moulage looks like on different people. Different skin tones, different patterns of bruising, whatever. But what we don't need is for that Moulage to be misrepresenting of a pathology, because then you're looking at the risk of negative learning into place. So anybody that's doing moulages need to do the research behind it as much as everything else, because otherwise it may potentially be jarring within a simulation and send students down a path that actually they think it's this, whereas you think you've developed that. So it does require practice, it does require research behind it, but it opens up those opportunities then for patients not to, for us to spot things, students to spot things. One of the things that we didn't know was bruising. Odd patterns of bruising, patients with different stages of bruising on them, fingertips bruising, all of those are opportunities for a radiographer, therapeutic step in and do some safeguarding around that patient. So it opens up a lot more than just a little bit of fun, though it is.
And Naomi, from your perspective, why do you think it's so important that students, especially in radiotherapy, learn maybe via simulation about the difference of radiation skin reactions on different tonal skins?
I think it's been based on a certain type of skin tone for a very long time. But even people who are really pale, they don't always go red. They might go straight to looking having a tan. I've seen that with some radiotherapy patients, but the global majority of people are people of colour. It's important to know. I think one thing that we always hear or I've heard is, we only see 1 or 2 black patients in a year. It doesn't matter. You've still got to be ready to treat them and help them. So yeah, it's just a way of changing it. And again, getting your hands on and stuff. So I donated my brown skins to people for them to have a look, and they're like, oh, I didn't realise it actually looks different on like the hairy part as opposed to the inside, which is a bit more fairer. But knowing that difference and seeing it in real life, yeah, I think it clicked in a lot of people's heads today, which is nice. So,
Brilliant. Well, thank you very much for joining us on the Rad Chat.
Thank you. Very much enjoyed it.